VYZULTA, latanoprostene bunod ophthalmic solution, 0.024% is indicated for the reduction of intraocular pressure, IOP, in patients with open-angle glaucoma or ocular hypertension. Please see important safety information at the end of this video.
When I talk to other physicians about glaucoma, the main thing I always like to talk about is why do people progress despite treatment? The main reason why people progress despite treatment is compliance. People have issue taking their drops, whether it's cost or whether it's ocular adverse events. The main reason in terms of ocular adverse events why people stop their medications is hyperemia. Fortunately with VYZULTA, in my personal practice, I haven't seen increased hyperemia rates. In fact, in my hands, in my patient population, that rate is very low.
In its pivotal trials, one of the things we found that in over 800 patients, we found that only 6% of those patients had conjunctival hyperemia. And this tends to be a problem sometimes with the prostaglandin analogs. As a physician and as a patient, that's a great thing.
Another area where I've found VYZULTA to be particularly helpful is in treating patients who are having tolerability issues. We'll use a variety of different PGAs in the practice of glaucoma. Patients may come in on those agents, but when I detect certain tolerability issues, that can be hyperemia, blepharitis, dry eye. So before I give up on prostaglandin analogs, I'll switch them to the VYZULTA and see what we get in terms of tolerability, given the safety profile that was demonstrated in the clinical trials.
But I think what's also important to understand is when you switch over or start a patient on a medication, if you start getting that hyperemia issue that you see sometimes, it's hard when patients call back and say, hey doc, I can't take this medication. You're back to square one. They're trying to find another medication, trying to talk about surgery. So I think that's been a surprise for me and the ease of switching over and writing a prescription like VYZULTA.
VYZULTA, latanoprostene bunod ophthalmic solution, 0.024% is indicated for the reduction of intraocular pressure, IOP, in patients with open-angle glaucoma or ocular hypertension. Important safety information. Increased pigmentation of the iris and periorbital tissue, eyelid, can occur. Iris pigmentation is likely to be permanent. Gradual changes to eyelashes, including increased length, increased thickness, and number of eyelashes, may occur. These changes are usually reversible upon treatment discontinuation. Use with caution in patients with a history of intraocular inflammation, iritis, uveitis. VYZULTA should generally not be used in patients with active intraocular inflammation. Macular edema, including cystoid macular edema, has been reported during treatment with prostaglandin analogs. Use with caution in aphakic patients, in pseudophakic patients with a torn posterior lens capsule, or in patients with known risk factors for macular edema. There have been reports of bacterial keratitis associated with the number of multiple dose containers of topical ophthalmic products that were inadvertently contaminated by patients. Contact lenses should be removed prior to the administration of VYZULTA and may be reinserted 15 minutes after administration. Most common ocular adverse reactions with incidence of greater than or equal to 2% are conjunctival hyperemia, 6%, eye irritation 4%, eye pain 3%, and installation site pain 2%. Please see full prescribing information at VYZULTA.com.